Bonjour, messieurs, dames. My name is Sandra Toriani. I'm working at Hoffmann La Roche in headquarter Basel, and I'm in charge for the serialization topics in Citrus, Middle East, and Africa region.
Bonjour, my name is Marco Schmidlin. I'm also working at Hoffmann La Roche in Basel as a supply chain business partner for Africa. And we are pleased to give you today some information about serialization. With that, I would like to hand over again back to Sandra.
Yeah. First of all, I would like to thank you that you give us the opportunity to share this information with you. And I already would like to tell you that in case of questions, please do not hesitate to contact us through Roche Algeria. Thank you very much. And with this, I will start to share the presentation. Why are we aiming for standardization and digitization? We want to reduce counterfeits and medication errors. In order to reach this goal, we are working together with regulators and customers on a common understanding of compliance. But we also see some business benefits in inventory planning and recalls. Our efforts are driven by external factors such as regulators and customers, and internal factors such as brand protection and control. What are the risks and opportunities? Counterfeits, diversions, and thefts are most of the highest risks for pharmaceutical products. With the implementation of serialization, we can avoid medication error, combat reimbursement frauds, have a better supply chain visibility, and increase or implement mobile healthcare and even e-services like our famous MV app. Regarding the business benefits, we want to ensure our right to operate and protect our branch. But we can also improve the recall process and have a better inventory control at the customer's premises. In addition, we meet legal and regulatory requirements. But the biggest benefit is for the doctors and patients who have a better control and trust in getting the right medicines. What are our current safety measures and what do we want to achieve? Codification is required mostly by hospitals to reduce medication errors, but also to support an electronic supply chain process. Serialization is mainly requested by regulators in order to verify the product at point of dispensation and fight against reimbursement frauds. Tamper evidence, which you can see here, which guarantees the pack integrity and avoids reuse. And last but not least, aggregation of serialized packs for tracking and reporting. The four elements of safety are identification. Each product and each physical location receives a unique identification code. The identification code is captured in a barcode printed on each pack. By scanning, each stakeholder can identify the product. This is This information is also shared through a reporting tool between all trading partners. This tool includes product data as well as good movement data. Patients can verify the integrity of the product through the tamper evidence label. Our safety measures at Roche are codification on primary pack, serialization and codification on secondary packs, auto pack, and aggregation on tertiary packaging through the serial shipment container code on the cardboard or on the pallet. And we include tamper evidence features. Let us see some features in details. The GTIN number, which is printed on the pack, is a product identifier which consists of 14 digits. The serial number, shown here, is a randomized numeric code which is different for each and every single pack. This information, as well as the expiry date, the manufacturing date, and the batch numbers, are printed in human readable form as well as included into the QR code. You can see here it's human readable, and we have the data carrier, our QR code. In addition, a tamper evidence label is attached here below. Aggregation means that a cardboard, including serialized packs, gets a barcode, which allows the recipient to simply scan the cardboard, the barcode on the cardboard, and to receive the information about all single serial numbers in the cardboard. This does not only work on a cardboard level, but it works even on a pallet level, which then includes all cardboard and all serial numbers in these cardboards. Sorry. The GTIN is a standardized identification key developed by GS1. A trade name item is any item upon which there is a need to retrieve predefined information, and that might be priced or ordered or invoiced at any point in any supply chain. This includes individual items as well as there are different configurations in different types of packaging. GTIN numbers are not only used for pharmaceutical products, but are very common for consumer products as well. Our products are all identified with a GTIN number, as it is the preferred standard in most of the countries. Here you can see an example about which information a so-called GTIN number gives you. It tells you about the product family, which in our case is Erivetch. It informs you about the dosage form, in this case capsules. It shows you also the strength of the product, in this case 150 milligram, as well as the pack size, which is 28 capsules in one pack, and it gives you information about the packaging makeup, in this case Portuguese. GS1. GS1 is our partner in Roche for standardization. It is an international non-profit organization dedicated to the design and implementation of global standards and solutions. Roche is working since 2013 with GS1 and is also a member of the Global Healthcare User Group. GS1 is represented in more than 100 countries And to our knowledge, also Algeria is one of these countries. Um, Roche Global Serialization experts are part of the GS1 Healthcare Public Policy Working Group, and they receive information about upcoming legislations in the countries, and Roche is providing feedback on draft regulations. If you would like to know more about GS1, then you can go on this link, which tells you more about it. Temper evidence features. Please see two examples on how temper evidence is implemented in Roche. For some products, we are using glue and perforation. You can see that on the left part. This is the original condition of the product. Here you can see if somebody has tried to open the pack, or if the pack is even opened, it cannot be reclosed. For other products, we put a label on the pack. This is this example. Once this label is opened, you cannot reclose it, or you need to cut it, and this is also evident for everybody. Both systems show the patients or doctors if this pack has already been opened, as it cannot be reclosed in a proper way. Now let's talk about the reporting system. How does the data sharing work? You can see we have flow of goods. So we are supplying goods from Roche to a wholesaler, and the wholesaler is supplying to pharmacies or hospital. The information flow is about all the serial numbers, and product data is going from Roche to the wholesaler, which is then reporting back into the national system, from the wholesaler to the pharmacy, which is also reporting back to the national healthcare system. Within our reporting system, we are able to share product information data and so-called event data. This means what has been sent where and when. The more downstream partners are included, like hospitals, clinics, pharmacies, the more data sharing is possible and the more safety we can guarantee. For this reason, we are implementing a full track and trace reporting system only if it is coordinated at national level and mandatory. Last but not least, let us remind ourselves about the 5 patient rights. Be secure the right patient gets the right product in the right dose at the right time through a secured channel. And maybe with your help in future, we can even include 2 more patients' rights, like getting appropriate information about the product and have a reliable supply chain. With that, I'm finished with the presentation. I hope this was helpful for you. And again, for any questions, for any information from your part, anything you would like to know, feel free to contact us through Roche Algeria. Many thanks and have a nice day.
Thank you.